to get the baseline for the coming discussion. We will identify a little bit about the problem, and we will see the results from the survey. And we also, in the end, made a comparison to a worldwide survey that was done by the ISAPs. So the problem, what is the wound and serious infection rate in aesthetic surgery? And how about the MRSA, resistant bacteria? And a question to all the respondents were, in what pattern do we use antibiotics? And the baseline starts here. The characteristics of the respondents are like this. So we had the Swedes that were very fast to answer, and when we had calculations in this, we saw that about 64% of the aesthetic surgeons in Sweden are responders. So the age of the responders are 40 to 60, and the mean procedures a year are around 300 to 400. But there are some outliers. I don't know who. There is an even distribution between single cabinets and larger centers. So, how do you track MRSA? And 30% answered we don't do any tracking since they are in good health and without infected wounds. But the majority do trackings, and they do track all the patients being inside a hospital abroad for the last 6 months. And there are a few respondents who track people being inside abroad hospitals for the last 2 years and last 10 years. And in the case of MRSI, do you consider surgery? And 25% said yes. So how about that infection rate? In face surgery, it's suspected quite low, very low frequency. In breast surgery, it's a little bit increased, where responders suspect breast reduction to be the most. For body, it increases with the peak for the post-bariatric surgery. So have you ever experienced a serious infection? And four respondents answered that they have seen group A, killer bacteria, streptococcus. And four respondents answered they have seen necrotizing fasciitis. And we had 11 answers in this. So have you had positive culture of MRSI in post-operative infection? And 2 respondents said yes. And the majority said no. So how about breast prosthesis? How is the frequency of infections that demands the removal of the implant? 31 of the respondents said that the infection rate is below 1%. But there are single respondents who answer 2 to 5 and 5 to 10%. What's your suspected capsular contraction? And we asked for the yearly basis. And the answer is about 1% within 1 year. And the capsular contraction increases after 2 to 10 years to be about 5% over 10 years. The seroma is not increasing in the suspected area. So how about ruptures? Do you suspect ruptures? What's your experience? And for both silicone and saline, all the respondents suspect the increased rupture rate. So how do you handle the breast implant area? A few dress the whole area. A lot of people cover just the nipple. We saw it on one of the videos from Hedén. A few people use scissors. Most of the responders don't. The majority change gloves. And there are quite a few who rinse the area with alcohol. And a few use chlorhexidine for the rinsing of the implant, and some 20% use antibiotics for rinsing the implant, and 12% use antibiotic to the pocket. No one uses iodine, and no one uses the Keller funnel. But most of us stitch in more than 2 layers. So how about the choice of drug? What antibiotics do we use? And in face surgery, for blepharoplasty there is no prophylaxis. And for face we use isoxazolline, followed by cephalosporin. And for breast and body, it's quite similar. Isoxazolline is dominating. But we can see for liposuction and fat to body, there is also clindamycin, thalazine, and fat to body and breast reduction has 30% of the responders who don't use any prophylaxis at all. And the lower body, how about that? We use isoxazolline, and for genitals and post-bariatric, there is adding metronidazole. So for how long do we prescribe antibiotics? In face surgery, it's no prophylaxis, it's the blue bar. And at surgery, perorally or intravenously, is the red and yellow bar. It's yellow in my screen, but not here. And this one is for 2 or 3 days, and this green one is 7 days. So we can see there are a few people, few responders who use antibiotics for longer times, but it's dominating in rhinoplasty for no prophylaxis at all, or IV at surgery only. For breast and body, we see that breast reduction has nearly 50% of people who don't give any prophylaxis, and the same for liposuction. And for 7 days, 2 and 3 and 7 days, there are 10% approximately in the breast augmentation group. So, and also fat to body. So for the lower body, we can see similar figures with IV at operation only is dominating, and we can see peak here for over 7 days for 12% of the responders. So when we compare to the ISEP study from 2011, we had the same question. Have you ever cultured a post-operative MRSA? Have you had a positive culture? So in Sweden we were in about 5%. And comparing to the other countries, we see United States responders were close to 40%, followed by Central America and Africa. And for how long do you prescribe antibiotics? And for breast augmentation in Sweden, we had about 10% of the responders who had antibiotics for 5 to 7 days. And for South America, there were 40% of the responders, Central America, even 50, Asia, 45-50, and so on. And for abdominoplasty, in Sweden, there were 15% approximately, and Central America, South America, Asia, once more is in top or bottom. So that was the survey, and now it's the panel.